Welcome viewers to our podcast. Today we shall discuss about the healthy issues. I am the host of this podcast. My name is Anderson Katana. I have my co-host. Welcome to our podcast.
Yeah. Let's go.
What's the matter? Are you okay? What's the matter with you?
I've got a terrible headache. I've got a temperature too.
What's the matter? Are you okay? What's the matter with you?
I've got a terrible earache.
Our objective today is to form. It is to inform the public and the community about the public issue that has been had out by the government, the Social Health Authority, MINSHA, what completes to the society and how it helps. I think it will be of more value when we pay our attention, we concentrate, and we'll get something from our podcast of today. Concerning today's highlights, we shall go and discuss about how a bigger number of Kenyan citizens are complaining about the Social Health Authority that was generated by the government. They're saying it was generated, but it is not functioning to their full. After that, we shall go on and discuss about how people are complaining at the hospitals by getting interacted with professional doctors and nurses. And the other issue that we shall discuss about the insecurity in hospitals, and four of the highlights we shall discuss about how nurses operate with pregnant women at the hospital.
Our children, our elderly people, people with disability, to access specialized care, to have and today live state house, when each one of them, and we have made sure we have activated and they have received in their phones a text message that going forward they are members of the Social Health Insurance Fund.
Tuko na mahospitali 9,000. Hiyo hospitali 9,000, any of those hospitals, you can now go to any of the hospitals with your today with your chief membership, and you can access.
The president also addressed concerns from county governments about the financial implications of absorbing universal health coverage staff. He acknowledged concerns about costs, but assured governors that the national government.
We have said that we shall discuss about the Social Health Authority, how it is operating to the society and how people benefit, and at the same time there are others say that they are not benefiting from that organization. So as we have our doctor here, we want she to tell us what are the benefits of SHA to the society.
Thanks for that question, sir. So the benefits of SHA, of Social Health Authority to the society is helping people in the hospital patients to, I mean, it's easy, let's say the way, I mean, those patients who have the chronic diseases, for example, their expenses, their treatment expenses are being solved by this SHA. Yeah. That is it. So that is the first benefit of Social Health Authority to the society.
I have another question that I need to ask you. For how many, how many times have you benefited from this organization?
It's for me several times, yeah. If I can say that, several times. But also my patients in the hospital, yeah, about medical hospital, many of them are benefiting from this support from the government. They are benefiting from this support, yeah.
Maybe have you benefited from SHA?
SHA, for me, it's like SHA is not working because it's not everyone can chance like to contribute so that it will work. So not anyone can contribute.
What about Immaculate? Have you benefited from SHA?
Okay, for me, I've not benefited from SHA. This is because for the last 1 week when I applied for SHA when I was sick, I went to the hospital to get the treatment. By that time, I was using NHIS, and when I went to SHA, it was not functioning, and I did not get any benefit from it. So for me, it wasn't functioning.
Yeah. On my side, I think I accompany Cynthia here and Immaculate concerning that SHA. And individually, I've not benefited from SHA because I think last 2 months I felt sick, and when I went to the hospital, they are saying that the document is not in the process. And I remember very well, each and every month I'm paying for that organization, SHAME. But when I went to the hospital, they're saying it is not functioning. So what can be the reason about this?
Yes, for that. No, it's not only not only people who are complaining about SHA not working. There are because some people who are complaining that SHA is not working for them. But others are saying that it's working for them. So there was this information from the cabinet secretary of health, that is Aden Wane, who was saying that there are some partners who are trying to bring the SHA down by stealing money which have been started by the government to help SHA work. But some partners are trying to steal those the money from the SHA and bring it down for good. And I think that may be this why it's not important people.
So I think that can be the reason.
Yeah, there are several reasons that why SHA is not working, but that is the main one that was aired out by the cabinet secretary of health. That is Aden Wane. Yeah, that is the main one.
I think I have understood. So, and the next issue on hospitals is that many people are complaining on getting the interactions and treatments from doctors which are not qualified. Maybe they have fake degrees and diplomas. These cases have been reported more in most hospitals in Kenya. So can you tell us more about this?
Yeah, I mean that is another issue that has been aired out by several number of people who have interacted with those new and professional doctors and nurses. Yeah, it's something of concern to the cabinet secretary of health and the government. Dr. William Ruto's government, that is it. So as you have said, there are many doctors and professional doctors and nurses who are hired with the fake degrees, fake diplomas, and they are now offering their fake services to the patients. Yeah, so many patients have lost their life by only being treated by those fake doctors, fake nurses. So I think what the government has to do right now with the cabinet secretary of health is to just put some strict rules to the hospitals, to the health facilities. The government must start some investigations with the cabinet secretary of health to at least find those fake doctors and nurses. Everything will be well. Yeah, the patients will be getting some helpful treatment and good services. Yeah.
I want to ask one question to both of you. I think since you are born, you have ever gone to hospital. Have you ever interacted with such a doctor?
Yeah, I've ever interacted with such doctors. There was a time when I was sick, and I was suffering from malaria, and I went to the hospital, and the doctor gave me the medicine, right? And by the time I was nilikuwa to take the medicine, I did not see anything. I was not seeing any change. Then again, I decided to go to another hospital, and nikaenda kwa hospitali nyingine nikaambiwa the disease was not malaria, it was typhoid. So there I was having some
And already the first doctor gave you the malaria tablets.
yeah, exactly, and I was taking them. I was taking the drugs, and the sickness ilizidi. So nikamua, let me try with another hospital if I can see any change, and see for any change.
I think this is very bad. What about?
For me, I've never experienced it because there's a time I was suffering from malaria, but yeah, nilipimwa then nikapewa hiyo dawa ya malaria na nikakuwa sawa. Sija experience hiyo about the doctors kana
So there is if you ever interact with someone, I mean, if you feel like, if you will ever interact with a fake doctor or a nurse, and you feel like if your memories are serving you well, that this doctor or this nurse who is offering this or a service to you is a fake one, just why can't you just report report to Mora? I need to help. Yeah.
I think that can.
There was even in Kabarnet, in hospital, there was this nurse. I didn't know even she was a fake nurse, but she was just hired. So a lady, fine lady. She was hired last year. Yeah. So she was hired. With a diploma. So she started offering us access to the patients until when there was a patient who came to me, and the other patient told me that she felt like the nurse was not offering the best access from this nurse. So I felt like there was a problem. So I started my investigation. I realized that that nurse was fake. She had fake documents. She brought to us fake documents, and that's how she was hired. The fake diploma. She didn't have any skill. That is how we help that patient. She might have died. The patient might have died.
Okay, so now there are other concerning other issues in the hospital is that pregnant women are mistreated by the nurses. As a doctor, have you ever mistreated some pregnant women?
As for me, I can't. I know the pain of pregnancy. I can't see. But I have experienced such operations to the patients indirectly by the nurses to the pregnant women in the hospital. So I have been seeing them. I have been seeing pregnant women being oppressed by some nurses and some doctors. Imagine someone telling you when you are being impregnated by your man or something, you are not feeling any pain. Now you are feeling pain when you want to deliver. Such an operation. And it's something of concern. Anyone who oppresses, any nurse or a doctor who oppresses a patient in the hospital needs to be arrested. Needs to be arrested. It's something of something very serious. How can you oppress a patient? You are here to offer your services to the patient and not to oppress the patient. Yeah. So it's something of concern.
And concerning the insecurities in hospital, because there are some cases which are being reported last week, we got a case that in the hospital kulikuwa na mgonjwa alijaribu kumwangamiza mgonjwa mwenzake. Kwani hizi hospitali hazina walinzi?
It's not like they don't have enough security. Security is high. Everything is well. Everything is in terms of security. In some hospitals, security is very is adequate, but in some hospitals, security is not adequate. Security is exactly. So as you see, this man was murdered. A patient was murdered by his own fellow patient, a man who was already. He was he was ready to be discharged from the hospital. So he decided maybe he had some issues with his fellow patient. They were in the same room.
From the backgrounds.
So he decided to first murder his fellow patient, then it will be good to just leave after murdering his fellow patient. So I mean it was a sad story. It was aired out by the public secretary of that is Amin Wale. So it was something very sad. So I think what the government and the public secretary that is Amin Wale needs to do with the issue of insecurity in the hospital is they need to just tighten the security guards in the hospital, and of course have some the fencing around the health facilities here in Kenya needs to be improved with some electronic fences and some those electrical equipment like the CCTV need to be equipped in those hospitals, and everything will be well. Security will now be in a good position to improve.
So now I want to take you back concerning the SHA. How can you help us? I need your assistance, and also this need your assistance, and also the public. They need to benefit from the SHA. So what can they do, or which documents are they required to go and register for that public organization?
So thanks for that question. So for now, SHA, if you want to register yourself, if you want to apply SHA, personally, I can say that the only document that is needed for someone to apply SHA is that is social health authority is only the birth certificate. That is the only document, and some maybe the identity card. And if you don't have a mean for the small kids, you can use for you can be helped by your parent or your bigger brother or sister. You can apply SHA with their new identity cards, and that is it's only the birth certificate and the IDs. That is it. That the only document for the SHA.
So what will the government take across for these people who can't afford because in SHA there are some money that are being contributed, right? So for these people who cannot get even unawezipata pesa hata ya kukula monthly salaries, how will the government help them?
As for me, what I can say about that issue of I understand there are some people who are they are making a good position to contribute to this SHA thing for now. So what I mean is that the government should do. The government has to do something about that. He has to at least have some small amount of money for those people. At least they will get some free services from SHA for now. Even though there are some problems in SHA, at least the government can do something about that.
For today, it was our podcast, and I think you have enjoyed well. You have get something from us. Tune in. We shall be here for the next episode. If you want to follow us in the social media, you can follow us at YouTube at Group 5 Health Hyper Group. Group 5 Health Hyper Group. WhatsApp number 0714 56676762. Facebook and Twitter. Thank you. Welcome viewers to our podcast.
Okay. Yeah. Let's go.
What's the matter? Are you okay? What's the matter with you?
I've got a terrible headache. I've got a temperature too.
What's the matter? Are you okay? What's the matter with you?
I've got a terrible earache. I've got a stomachache too. Oh dear.
Are you under the weather?
Oh dear.
I hope he gets better.